Next speaker I am very happy to extend a warm welcome to is Dr. William Sheffield. Bill and I have known each other for over 3 decades. And, well, he could say a lot of interesting stories about me. And I better not, because he could catch me, because he is an elite marathoner in his age group. He was the first one that lifted his head and laughed, about that joke. Anyhow, Bill completed his doctoral degree in biochemistry at McGill University in Montreal. I will spare you the year. He joined the Faculty of Health Sciences at McMaster University in Hamilton, where he is full professor in the Department of Pathology and Molecular Medicine and Associate Director of Research with Canadian Blood Services. His research centers on plasma protein products in transfusion and novel applications of plasma proteins, which he will tell us about now. Thank you very much for joining us, Bill.
Okay, so I won't tell you any stories about Dr. Prysdale. Instead, I will focus on the task at hand. It's difficult because I keep on thinking about all the interesting conversations I've had today, the posters, all the talks, but time is of the essence. I'm between you and the refreshments, so I have no conflicts of interest, and neither does the dog. The dog is a visual cue to me because he is on a short leash. And that is what I intend to keep myself on, if possible. No rhetorical flourishes, no jokes, no side trips, no stories of Ed back in the day when we met in the previous millennium. Okay, so when Ed Conway kindly invited me to come and speak, he said, you can speak about some designer proteins you've made in your lab, and I'm happy to follow through on that. Specifically, I want to talk about engineering serpins to improve the control of kallikrein. And that means I need to fill you in a little bit on the serpin superfamily of proteins. I don't think anyone's talked about that today. I'm going to save some time about kallikrein, which is involved in the contact activation pathway, which we've heard about from a couple of speakers. And I'll tell you about 2 ways in which we've tried to engineer proteins in order to control kallikrein. And this involves modifications of both C1 esterase inhibitor and alpha-1 antitrypsin. I'll wrap that up. I may talk about future experiments if I'm not getting scowls from our moderators, and that'll be it. Okay, so serpins. This is an acronym for serine protease inhibitors. It's a superfamily. It's a very large family of proteins. When it was initially described, it only had 3 members: alpha-1 antitrypsin, antithrombin, and ovalbumin, which we heard about earlier today. And it's now known that it's a large and widely distributed superfamily of protease inhibitors. In humans, there's around 36, 37 serpins, and they control inflammation, coagulation, fibrinolysis. Because of my focus on plasma proteins, we primarily look at the serpins that are found in plasma, but there are many other serpins that are intracellular, but again, focus. So serpin A1, there's 16 clades, and it's the evolutionary relationships are well described. So alpha-1 antitrypsin, or serpin A1, its natural target is human neutrophil elastase. It's a relatively small serpin, relatively uncomplicated in terms of its glycosylation, with only 3 N-glycans. Do I have a mouse here? Yeah, okay. So you can see what unifies the serpin family. And the short answer is it's this common fold. It's a protruding reactive center loop that interacts with proteases for inhibitory members of the family, and a central beta sheet, which is involved in the molecular transformation when an attacking protease interacts with the reactive center loop, forms a tetrahedral intermediate, and then moves on to an acyl intermediate with bond scission. And then it gets the surprise of its life. It is, because of the stored energy in the serpin, it's translocated to the other side of the molecule and forms a covalently bonded inhibitory complex. So that's the hallmark. That covalent complex is the hallmark of an inhibitory serpin. In the middle, we see C1 esterase inhibitor, but you can see how it has that conserved fold and general physical appearance, except it's got a long N-terminal domain shown up in the linear diagram on the top. So it's a more complex serpin. It's longer than alpha-1 antitrypsin. It has multiple targets, including C1 esterase, plasma kallikrein, and factor XIIa. And it has a multitude of glycosylation sites, 6 N-link glycans and 26 O-glycans. So that's about the serpins. Why would we want to adapt them in order to have improved control over kallikrein? And kallikrein is, one might call it a coagulation factor. I think of it as being somewhat coagulation adjacent. So we heard earlier about its role in contact activation, where factor XII can become auto-activated and can activate pre-kallikrein to active kallikrein, which can then go and activate more factor XII and feed forward and cause that signal to proliferate. But the reason I call it coagulation adjacent is it has another important activity, which is to act on high molecular weight kininogen and to generate bradykinin. And bradykinin is a vasoactive peptide important in the control of fluid balance. It mediates its effect by interacting with one of two receptors. And overactive kallikrein leads to pathological edema, as we see on the next slide. There's a specific inherited genetic disorder called hereditary angioedema, and up in the right-hand side, this is the same person when she's is not undergoing an HAE attack, and then as the hours progress. So there's a pathological swelling. If it involves the airways, it can be life-threatening. The genetic etiology is a deficiency in C1 esterase inhibitor, and fortunately, it can be treated by either on-demand or prophylactic treatment with purified concentrates of C1 esterase inhibitor. But this is an expensive therapy. In 2019, I think it was, the last year that Canadian Blood Services provided publicly available numbers, it cost CBS and the blood system approximately 11% of the entire budget, the whole CBS budget, to provide C1 esterase inhibitor concentrates for the treatment of approximately 200 patients prophylactically and a similar number episodically. So it's an expensive treatment, and perhaps there's room for improvement. One reason it's so expensive is that, unlike other plasma proteins, C1 inhibitor is present at a very low levels, and so it requires a lot of purification in the plasma and concentration in the plasma fractionation process. So we had two ideas. One was to extend the half-life. Well, one was to simplify recombinant C1 inhibitor, and we wanted to do that by getting rid of the glycosylation. But we realized that in getting rid of the glycosylation, we were going to make the molecule smaller, and it wouldn't last as long after intravascular injection. So that would be 2 steps forward and 2 steps back. So we also decided we needed to extend the half-life of our simplified recombinant C1 inhibitor. And secondly, we wanted to make alpha-1 antitrypsin a better plasma kallikrein inhibitor by mutating its RCL. So like many alpha-1 antitrypsin, you can measure a rate of inhibition for many proteases. For instance, you can measure a rate constant of inhibition for thrombin of about 60, and 60 per molar per second. But that's really, really slow when one thinks of a more physiological interaction between alpha-1 antitrypsin and human neutrophil elastase, where the rate constant is on the order of 10 to the 8th. So we wanted to redirect antitrypsin and perhaps get a faster inhibitor. And in so doing, we were following two established lines of research in my lab, exemplified by the paper on the top, where we had fused a small peptide, which is a kallikrein inhibitor, to human serum albumin. And in the second, where we used phage display of an alpha-1 antitrypsin library to select for a hypervariable library to select with a different protease for variants with a redirected proteolytic specificity. So we express the proteins in P. pastoris, which is a methylotropic yeast. Expresses large amounts of protein. It doesn't secrete many proteins, so if you target your protein for secretion, you simplify purification. And of course, we also cheat by putting on a His tag so that we can use nickel chelate affinity chromatography. So I told you before about plasma-derived C1 inhibitors shown in the top. We engineered a protein that we call MGS, which is short for multiple glycosylation sites. It's also truncated. We got rid of that extension that's not found in other serpins. We mutated out the 3 sites of N-link glycosylation, and that's our simplified but rapidly cleared molecule. And we also fused murine serum albumin in order to make a long-lived version. More recently, we added to this list the reverse orientation. So we initially had the serpin N-terminal to the albumin carrier protein, and more recently we reversed the geometry. So the first thing, and this is all the work of my graduate student, PhD candidate named Sangavi Sivananthan, who I asked her if she wanted to come here, and she said no, she'd prefer to work on papers towards graduating in 2025. And I was like, okay, cool. So if we look at the rate constants, so C1 inhibitor inhibits both C1s in the complement system and plasma kallikrein at a relatively slow rate constant of around 2 times 10 to the 4th. So the first thing we noticed once we did the kinetics was that we had some loss of activity or slowing of the rate of inhibition by about 10% when we truncated and simplified the molecule. And then when we added the fusion protein, we did have a loss of activity, but it was less than 2-fold, whether we did it in either orientation. The reaction with C1s was unaffected, but it is not of interest to us. And the last indicator is a measure of efficiency or reaction stoichiometry. And this was slightly increased, as in we need more serpin molecules to inhibit a single protease than we do with the plasma-derived equivalent. When we looked for the hallmarks of serpin activity, on reducing SDS gels, we could see covalent complexes for the interaction of plasma kallikrein. This is reducing gels, so it's broken up into its heavy and light chain, and there's some variations, variation in length within the commercial preparation. But we could clearly see that the catalytic chain had been elevated into a high molecular weight covalent complex in the case of plasma-derived C1 inhibitor. We initially didn't see that with our fusion protein. We see it with the simplified short form, and we see it with the second geometry that we made. And I don't have time to go into this, but essentially we eventually figured out with no help from every anti-kallikrein antibody that we bought, none of which work on immunoblots, that we had reduced the input size by the same amount that we'd increased the covalent complex. So covalent complex formation happened in both cases. What about half-life? So here you can see the clearance curves after we injected the protein into mice, and as Dr. Prysdale intimated, I'm not the youngest researcher ever, and I recently let go my radioisotope license with some degree of unhappiness. And as soon as I did, it became clear to me we'd have to determine the clearance of this protein. But the good news is we did it non-radioactively using an ELISA protocol. And here you can see that the both recombinant murine serum albumin and the recombinant fusion protein with the C1 inhibitor were slowly cleared, in contrast to the truncated form, which was cleared much more rapidly. When we did the solving of the clearance equations, we could see that the prolongation was statistically significant. And we also more recently went back to the reverse geometry form lasts just as long, if not longer, which is the message from the insert graph. So this was relatively successful. We extended the half-life, check. We hadn't taken too much of a hit in terms of the rate of inhibition. The enzyme was a little bit slower, but I'm way slower than I used to be as a recreational runner, so not too much of a loss. But overall, we couldn't change the fact that C1 inhibitor is a relatively slow inhibitor of plasma kallikrein. And reasoning that the faster the inhibition, the better, we wanted to try another strategy. So we wanted to make alpha-1 antitrypsin a better plasma kallikrein inhibitor by mutating its reactive center loop. In so doing, we were following a long line of research that was started with the clinical presentation of a young patient from Pittsburgh who had a mutation in the reactive center loop, which changed the specificity of alpha-1 antitrypsin away from inhibiting neutrophil elastase and towards inhibiting thrombin. And eventually, the index patient succumbed to a bleeding disorder. So this started researchers thinking that we can redirect serpins by changing the reactive center loop, and there have been many efforts to do so. In my lab, we've used phage display. So we use a T7 bacteriophage system. We display alpha-1 antitrypsin as a fusion protein to a bacteriophage coat protein, and we make it hypervariable. So it's got all possible combinations at 5 amino acids in the reactive center loop. And we have a number of these libraries because for reasons to do with the quality of the biopanning or screening experiment and having enough depth in the library, we can't do the whole reactive center loop at once. So we had done this with factor 11A with some success, so we decided to biopan libraries with kallikrein. And this is an iterative process because there's a lot of background signal, but nevertheless, if you keep doing it enough rounds, you can get candidates that may fit the specificity you've been looking for. So in this instance, what you can see is this is the reactive center loop, the 2 sectors that we looked at, wild-type sequence, Pittsburgh M358 background sequence is shown in blue, and then the selected sequences after we screen the 2 libraries. And what did we get in terms of selectivity? First off, we had improved the rate of reaction with one of these that we call in the lab QLIPs because that's the amino acids, and you can actually make a word out of it, and that simplifies lab meetings a lot. So we had an increase in the rate of inhibition of kallikrein. We had a decrease in the rate of inhibition of factor 11A, and so we'd increased the selectivity. And we hadn't taken a hit on the efficiency of the reaction for plasma kallikrein, whereas the reaction with factor 11A, which we did not want, the efficiency had gone way down. If we look at the other motif, more C-terminal, or V-ray, also apologies to the English language for this acronym, made-up name, this was not as successful. So we focused upon the first set of motifs, and we back-mutated them. And I'll summarize a lot of mutagenic and kinetic analysis by saying that one of these, which was partially reverted back to our starting sequence, showed the best increase in selectivity. Supporting our original hypothesis. So this one we call FLEPS because those are the substitutions. It's only 2 substitutions out of the motif that we looked at. So we have an increased speed of reaction of plasma kallikrein. It's closer to the high-speed serpin inhibition that we were aiming for, although not by a huge degree. It's 9-fold more selective for kallikrein over factor 11A, And we picked factor 11A deliberately. If you pick thrombin is special, and you will see an increased specificity. But I suspect that reviewers will ask us for that. So we're ready. That paper has been submitted. The other one about the half-life appeared in PLOS One last month. But we were a little bit disappointed because the same approach, taking the biopanning the libraries and then combining and back mutating until we got the most active protein without losing the gains in specificity that we'd achieved. The same approach was way more successful when we were working with factor 11A than with kallikrein. And you can read about that in papers we published in Frontiers in cardiovascular medicine. So that's it. I did tear through it. I feel pretty good considering my natural tendency to tell side stories and jokes and try and curry favor like that. But instead, I thought I would tell my story, get to any questions, and you'd be free to enjoy the refreshments at the end of this wonderful day. I do have to name the people, so I've already told you about Sanghavi Sivananthan, who's the PhD candidate. She did most of the work. She was assisted by Varsha Bhakta, my wonderful senior research assistant. And there's nothing in my lab that comes out of my lab that has to do with recombinant DNA technology that she doesn't have a hand in. She was also assisted by Nagin Chayachi Tehrani in some of that work, and Nagin also assisted Sanghavi and in the mouse work. And she gave permission for Enzo to appear. Although I told you Enzo was on a short leash, Enzo has never been on a short leash in his life. I told Sanghavi about this talk and how I was going to have to wrap it up quickly, keep myself either reined in or on a short leash, and I needed a picture of either a horse or a dog. And she sent me 15 pictures of Enzo, her beloved Doberman Husky mix, a dog so pampered that she was concerned for his eyesight during the solar eclipse, which went right through our region, totality, went right through, that she stayed inside with him rather than risk any problems. So Enzo's never been on a short leash, but I found the image helpful to tell my story, and I would be happy to take any of your questions. Oh, I forgot to thank Ed. Ed loaned his good name to an attempt to get funding for this, even though we were unsuccessful. And Sanghavi received a fellowship from Canadian Blood Services to support her doctoral research. And the rest of the funding comes from, shall we say, discretionary resources.
Thanks, Bill. That was great. I noticed that you didn't mention anything about heparin or as a cofactor for C1 esterase inhibitor in your functional assays. Is there a reason?
There is a reason, because when we looked into the literature, we saw some disagreements as to whether there was an effect of heparin. And those researchers who had found one, it was less than twofold. So this is pretty minimal for heparin, which can accelerate the rate of thrombin or 10A inhibition by antithrombin by 3 orders of magnitude. So we didn't pursue it. Actually, thanks for reminding me of that. Sanghavi did do some initial experiments, but as we expected from the literature, we didn't see any effect, and so we didn't pursue that.
Right. No, I do agree. It's certainly not like antithrombin, but and it varies with the enzyme, the target enzyme for sure. I don't remember about kallikrein actually.
Did you try to incorporate sequences of kallikrein substrates into your serpin instead of doing the scanning?
Thank you for that question. That's the subject of the paper that Sanghavi is working on right now. And you're quite right. That's also a time-tested approach. We grafted the reactive center loop we replaced the reactive center loop of alpha-1 antitrypsin with C1 inhibitor. And initially, we found that molecule is inactive, but the reactive center loops are of slightly different lengths. So once we took that into account and we started moving the crossover point, so we had less than complete replacement, we did see some improvements in selectivity, and we're going to, that will be ready for submission in the coming months.
I have one dumb question, then another question after that.
Where am I looking?
Why don't you just use recombinant C1 esterase inhibitor as opposed to making a novel molecule?
It's a good question. There is a recombinant C1 esterase inhibitor on the market. It's made, believe it or not, in the milk of transgenic rabbits. It is horrendously expensive, and it is cleared from the circulation very rapidly. So that's one reason why we didn't just go there. The second reason is we wanted to use the P. pastoris system because while we can do cell culture, we haven't had good experiences with it. We don't have bioreactor setups. So the P. pastoris system generates a lot of protein, and we were looking to use it for proof of concept. Moreover, we found that you need to avoid end-link glycosylation with the system because it hyperglycosylates and it puts glycans that are recognized as foreign by mammalian systems. So excellent point. My answer is somewhat roundabout, but those were some of the things we were thinking of when we elected not to go that route.
My second question is what the approval process is for plasmid-derived C1 esterase inhibitor vis-a-vis the economic burden on the blood system, and whether it gets to the general question of getting an approval process for a rare disease, which is you can't really do trials at the level pharmaceutical companies do it. So, historically, was it approved at a time when things were lax and now people have a barrier to get into the market to develop an improved product that would be more economically feasible?
I think the short answer is yes. I didn't tell you the full story. There are recombinant engineered antibodies which are specific for either plasma kallikrein, which is licensed, or for factor 12A, lanadelumab and gardemacimab, I think. That one is either recently licensed or approaching licensure. So, pharmaceutical industry has put all kinds of money into convincing regulators that these engineered antibodies are safe and effective. In Canada, initially, lanadelumab, when Canadian Blood Services asked to distribute it, the funders turned us down, and their idea was it was too expensive. But these are really marvelous drugs. So anyway, all of this was what we were thinking. We realized that we're a research lab. We would, if we were lucky and we found something potentially useful, we would secure the IP and we would happily license it to somebody else.
That was a beautiful bit of engineering. Thank you. I just have a technical question, perhaps. With the phage display, what was the size of the polypeptide that you were displaying?
So we displayed the full serpin, which is 394 amino acids. I forget the size of the bacteriophage T7 coat 10 protein, but I think it's of similar size. So it gives us a protein of around 70 kilodaltons in total.
And that behaved well on the phage? Yeah.
It did, yeah. I had a graduate student years ago. I've been trying to interest students in this idea about a powerful technique for screening mutants, and nobody wanted to play ball until Benjamin Scott came along. And so we tried this system. We initially tried to make a better thrombin inhibitor out of alpha-1 antitrypsin M358R. So we got a twofold improvement. But the important thing was we learned how to use the system. And thank you for calling what we do engineering when you make universal red cells.
So I'd also be interested to chat sometime about how you screen when there's a covalent event, because that makes things much harder, I think, yeah. Yeah, but we'll do that also.
The short answer is we could wash really hard.
Right, exactly. Thank you.
Bill, I have a question from our friend and colleague from Queen's University, David Lillicrap. He says, great talk. Is there evidence that novel variants of serpins pose an immunogenic risk, and can you screen for this?
So a great question. I'd expect no less from David. There haven't been a lot that have made it to the market. There is one that Jim Huntington's group at Cambridge has, with two modifications, only two changes. He converted antitrypsin M358R into being an effective inhibitor of activated protein C, and I understand that's in clinical trials. And there was a phase 1 clinical trial with a viral serpin called SERP1 that showed safety in one of the cardiovascular indications. But apart from that, we're not sure. Whenever one mutates a protein and gives it to a host, there's a potential for that actually expresses that protein. There's potential for immunological reaction.
And with that, let's have some refreshments.
Oh no, that's not right.